third fontanelles has been 6.4% in unselected population of 1020 newborns. So this one is a rare fontanelle. Between the anterior fontanelle and the posterior fontanelle, there is a third fontanelle present in the neonates. So molding of the fetal skull, how it is molding during the birth delivery. This topic is related to the labor. When the female goes to the normal vaginal delivery during this process of the molding starts. So what is molding? Molding is a means shape, approximation or overlapping of the skull bone. The bones of the neonatal skull overlap over the sutures. When neonatal skull makes a new shape for to help or ease for the vaginal delivery. So adaptation of the fetal head to the pelvis cavity during the birth called the reduce the head circumferences. During the birth, the pressure on the head caused by the tight birth canal may cause the mold. To mold means shape, change the shape, the head into the oblong rather than the round shape. As the picture shows, there is the birth canal, there is the molding of the head. And the second picture shows there is the molding of the head. So outcome of the molding resolve after the delivery or within the few hours. It takes a few hours. The fetal skull contain the brain, which may be subjected to the great pressure on the head passes through the birth canal. So during the term condition, 37 to 40 weeks of the pregnancy during the delivery, fetal skull is then pelvis. So there are different presentations and the obstetrical importance. The cephalic presentation during the delivery has the vertex, brow, and the face. As the picture shows, there is the vertex, brow, and the face presentations. So this picture shows is the vertex, brow, and the face presentation. So vertex is the area between the anterior fontanelle and the posterior fontanelle and between the two parietals bones. While the brow is from the anterior fontanelle coronal suture to the root of the nose or orbital ridges. And the face areas between the from the root of the nose are the supraorbital ridges to the mentum or the chin of the mandible. So this presentation is a vertex presentation in which their head is fully flexed and it is quadrangular area bounded anteriorly by the bregma and the coronal sutures as already discussed, and posteriorly by the lambda and the lambdoid sutures, and laterally by the lines passing through the parietal eminence. Brow are sincipital presentations. Head is partially extended. It is an area bounded by one anterior fontanelle or bregma, coronal sutures, other side by the root of the nose and supraorbital ridges of the either sides. And the face presentation, the head is completely extended. It is area bounded one side by the root of the nose and supraorbital ridges, and other side by the junction of the floor of the mouth with neck, mentum, or the chin. As the picture shows, there is the arrow, there is the mentum of the chin, and the root by the supraorbital ridges are the root of the nose. So in the last one is a diameter of the skull and its relations. They are classified into anterior and the posterior diameter are called the longitudinal diameters, and other are the transverse diameters. So what are the importance of the diameters? When the fetus come in the delivery time in the uterus lower pole or pelvis, then the diameters are measured. So which diameter is there? So what attitude according to the diameter? Attitude means relation of the fetal part to the one another, like the extensor presentation, flexed or the partially complete, or the completely flexed or deflexed. So they are classified, anterior-posterior diameters are classified into six categories: suboccipito-bregmatic diameter, occipito-frontal diameter, suboccipito-frontal diameter, submento-bregmatic diameter, mento-vertex diameter, and submento-vertex diameter. I will describe everyone in the next slides. So what is the suboccipito-bregmatic diameter? So this diameter starts from the occipital region, in which the head is flexed and extends from the occipital protuberance till the bregma, and the size is 9.5 centimeter. As the picture shows, there is the occipital protuberance to the bregma of the skull. Occipitofrontal diameter, in which head is deflexed, extends from the occipital protuberance till the glabella. As the picture shows, there is the from the glabella to the occipital protuberance. It is size is 11.5 centimeter. Suboccipitofrontal diameter, the point below the occipital protuberance till the midpoint of the frontal suture. The size is 10 centimeter. As the picture shows, there is the front mid of the frontal suture and there is the occipital protuberance. Submentobregmatic diameter is the head is fully extended. It starts from the mentum of the chin, and the point extends the chin to the bregma. Bregma is the point where the two sutures, coronal sutures, anterior suture, and the sagittal sutures meet. And size is 9.5. Mentovertex diameter. It is highest diameter of the anteroposterior diameter, in which there is a head is completely extended. The point extends mentum of chin till the point of the vertex. As the picture shows, there is a from the mentum of chin to the vertex point. This one is highest diameter, size from 13.5 to 14 centimeters. And the submentovertex diameter. In submentovertex diameter, the point extends from the chin joint to the neck till the vertex point. The size of the submentovertex diameter is 11.5 centimeter. And last one is the transverse diameter. In the transverse diameter, there are 4 types of the diameters. There are the biparietal diameter, bitemporal diameter, supersubparietal diameter, and bimastoid diameter. And one by one, by the biparietal diameter, distance between the two parietal emitters. As the picture shows, these are the parietal emitters. Between the two, there is a biparietal diameter. The size is the biparietal diameter is 9.5 centimeter. And the bitemporal diameter, it extends from the farthest point of the coronal suture at the temporals. Its size is 8 to 8.5. This is the bitemporal diameter. Its size is 8 to 8.2 centimeters. And supersubparietal diameter. As the picture shows, the supersubparietal diameters, it extends from above the parietal eminence of the one side till the below point of the next parietal eminence. As this picture shows, the above from the one parietal eminence and second from the below the parietal eminence of the next of the parietal bone. And the size is 8.5 centimeter. And in the last, there is the bimastoid diameter. The distance between the mastoid process of the temporal bones, size is 7.5 centimeter. It is smallest diameter of the transverse diameter. As the picture shows, the red line shows there is a bimastoid diameter. So this is all about the anatomy of the neonatal skull.
Thank you, Dr. Suhail. Dr. Shad Ayub, are you with us? Okay. Thank you very much, Dr. Suhail. We'll see there is
Thank you, sir.
Any discussions or any questions regarding this presentation.
Dr. Ahmed, I'm here. Yes, I have.
Okay. Do you have, Doctor, any comments or questions or
regarding the?
I think it was a nice presentation. Very detailed overview of the skull, neonatal skull with all sutures. I think if the audience have any question, they are welcome to ask questions.
I have a question for you, Dr. Suhail. Yes, regarding the diameters you talk, usually the most common diameter we usually measure is the occipitofrontal diameter. Can you please explain how for residents or for medical students how to measure the diameter for the newborn?
During the I think birth delivery, during we are reading the.
وعليكم السلام. Security guard. خيام security security.
Yeah, I'm guessing.